So I'd like to welcome everybody to the Medical Marijuana Wellness webinar. Tonight's topic is going to be anxiety and stress in medical marijuana. It's a kind of a popular topic and one that a lot of people obviously in this environment have had the opportunity to unfortunately experience. We're going to talk about it, medical marijuana, and how it can help you. We thank everybody for showing up tonight. We know it's important time. Your time is important, so hopefully we'll provide some clear information. Now, the objective of this webinar is very simple. We have a kind of a mantra that we like to help people get their life back. And if tonight's information in tonight's webinar can at least help at least one person, help them get their life back, we feel that we've accomplished what we needed to accomplish. Please feel free to ask questions. That's what we're here for. If you look at your screen, you'll see a little Q&A button down over here, and you probably see, and so if you have any questions, please feel free to ask questions. We'll be monitoring the question board. We'll try to answer the questions either during the webinar or after the webinar, but we definitely are here to answer your questions, and please feel free to do that. A lot of people put information into chat. You can do that, but we really pay more attention to the Q&A, so I don't want to have your question get lost by you sticking it in the chat that's there. Again, we are here to answer your questions and provide some accurate information on anxiety and stress. Tonight, I have a co-host. She's the community educator for MOVE, and MOVE is our sponsor for tonight. So I'd like to introduce Chelsea Millsaps. Chelsea, tell me a little bit about yourself, and tell me a little bit about yourself and medical marijuana.
Hi, good evening. Thanks everyone for joining us. I'm the Southwest Regional Sales Representative here in Florida. I cover territories from Marco Island up into the Parish, Florida territories, and educate docs as well as patients when I have the ability on medical marijuana in our MOVE dispensary.
Great, super. Well, listen, I don't want to spend too much time on introductions. I want to kind of get into the subject matter. So if you don't mind, I'm going to switch over to a slide presentation. I'm not trying to make this presentation be slideware, but what I am trying to do is have this be a presentation so that what we can do is we can get into some slides that talk about various topics to be able to spur questions, to be able to hopefully provide some information. So as I mentioned earlier, the objective of our webinar is to help people get their life back. If we can help, if the information from this webinar can help just one person make their life better, we feel we've accomplished what we wanted to accomplish. But really, we're here to help as many people as we possibly can. It's important to point out that this is a medical marijuana webinar. So for this purpose, we're trying to be safe, supportive. All the information has been vetted by pharmacists and also by doctors and medical cannabis experts. And we also want to make sure that we have the right information for you that we're providing and bringing forward. As with any other medical condition, what we recommend is that people consult their doctors when they're looking at making medical decisions. We feel that's very important to be able to do that so that, again, your doctor is part of your team, and so make them part of this particular experience. We're not trying to replace your doctor, but we are trying to provide the information that your doctor may or may not have about cannabis. And really what we're trying to do is bring together cannabis advocates, patients, researchers, doctors, really so we can all learn about this particular topic and this particular subject. So let's talk a little bit about anxiety and stress for a second. Let's define what they are, because once we're going to talk about how to manage them, let's talk about what they are and how they're there. Anxiety is ongoing. It's something that escalates over time. It's an escalated response to stress. Anxiety is something that people have, especially in the last year. It's something that's been there. It's a stressor that comes into place and gets people to be very anxious. Anxiety is typically characterized by a persistent feeling of apprehension or dread. It doesn't necessarily have to be threatening. You just have this apprehension of anxiety and dread, and that's something that defines what anxiety is. Now, stress is a little bit different. Stress is something that, this is how your body and this is how your brain responds to different challenges, such as performance at work or at school, a significant change in life, or basically a traumatic event. It is a physical and mental response to an external cause. That's the difference between anxiety and also for stress. Anxiety is interesting in that it's also one of the most common illnesses that's found, at least here in the United States and throughout the world. 264 million people worldwide have what they call anxiety disorder. And there's some studies have been done, and these studies were done actually prior to the COVID outbreak. That 31% of adults in the United States have experienced some sort of anxiety disorder at some point in their life, and that 19% of those people have experienced it in the last year. And I think that if we did a study right now, that number would be considerably higher than 19. The reason we bring those numbers up is for people to feel comfortable that if you feel anxiety, you feel stress, you're not abnormal. There's a lot of people out there just like you. This is something that's a normal response to what's going on around you. And it's something that you shouldn't be ashamed of. It's something you should recognize as a condition. And there is ways of being able to treat it and to be able to address it. These anxiety is typically brought on by a number of different things. It could be OCD, it could be PTS, it could be social, but it's something, again, don't view yourself as being abnormal. View yourself as somebody who's absolutely normal. It's just a matter of this is the way the human animal, the human body manages certain situations that are there. Now, stress is a bit different. Stress usually has a trigger. Some sort of a trigger causes you to have some sort of stress, and chronic stress can affect your health. People that live under stress for a long time have symptoms. They have headaches, they have high blood pressure, they get chest pains, skin rashes, loss of sleep. Stress is something that will affect your health, and stress affects everybody. Nobody's immune to stress. Now, there are certain times where stress is not bad. It can be an intimidator or it can be a motivator. I mean, there are times when stress can be something that motivates you to go do something. I at one point in time, was an athlete. And as an athlete, although I was stressing about certain events, it motivated me to practice a little bit harder. It motivated me to make sure I was prepared for my events. Excuse me, let me go back for a second. It was something that I used to be able to motivate myself and to be able to perform better. And to be candid with you, once I was on the court, once I was able to perform, it actually got me to relax. It was something that really helped me elevate my level of performance. If you are overwhelmed by stress, if something is where stress is a point where you're overwhelmed and you feel that you're just buried in it, ask for help from a healthcare professional. They are out there, especially with this COVID environment that we've had to go through. There's a lot of healthcare professionals that are available. They don't necessarily cost you money, or they may not cost you anything, but please get some help. You're not abnormal to feel stressed. This is a normal human reaction, but I think it's something that you don't leave it untreated, because it's something that may or may be something that really won't be able to help you very much. Now, let's talk about medical cannabis and what does research say about medical cannabis and stress and anxiety. Well, what they found out through research is that the endocannabinoid system, which we'll talk about in a little bit about what that is, but every human being has what they call an endocannabinoid system, and it plays a huge role in regulating anxiety, fear, and stress response. And that's something that we've been able to go out and be able to scientifically find and know that it's there and be able to research. Individuals suffering, for example, from PTS and chronic pain have been reported to have reductions in the amount of stress by using medical cannabis. And that, again, is research that's been done that's out there. We know that cannabis does reduce a lot of the stress that's out there and does help quite a bit with anxieties. And what we're going to talk about later on in the presentation is we're going to talk about terpenes. And cannabis terpenes have also been found to be very, very helpful in being anti-anxiety medications. The fragrances, a lot of people have heard about essential oils or fragrances that produce, for example, aromas that really get you to relax. Well, cannabis has those same properties, those same terpenes in them, and you can get, like, lavender helps people relax. Lemon has been proven to do that. These are things that you'll find that are involved or are in cannabis, and these are things that you can take advantage of to, again, to manage your anxiety and your stress. And what's interesting is there was a study done in 2020, or it was actually released, I should say, in 2020, showing the cannabis and 2-AG. 2-AG is one of the elements in your body that helps with your receptors, is something that can help be able to help in your brain be able to help you control the anxiety and stress. So there's been studies that are out there, And you'll find that at the end of this webinar, we're going to provide for you a follow-up email and a link to a page that will give you a copy of this presentation, a video of a copy of the video, a copy of the presentation, the research material, and then of course a patient information guide that has not only information on how we can help you with medical cannabis, but also it has some discount coupons on you, discount coupons for you to be able to take advantage of medical cannabis. But what I'm trying to point out is there are studies that are out there that have been able to help. Now let's get down a little bit deeper and talk about anxiety and stress, CBD and THC. When it comes to using, for example, a high THC cannabis product, which a lot of people do, especially recreational users, what we've found is that THC in lower doses really helps cannabis. Cannabis really helps in lower doses, really helps with anxiety. But if you use a lot of THC, so in other words, use it in higher doses, it actually makes the anxiety worse. So here's a situation where when you're using cannabis, when you're using medical cannabis, we're looking at low dose medical THC in the medical cannabis that you use. You have to be, and this is where you have to be very careful with edibles, because a lot of edibles are very high in THC and very low in CBD. So people will say, well, gee, just try an edible. It's going to help me with my anxiety and stress. And be very careful to read the label that's on that edible, because unless you have some CBD in there and a pretty high balance of CBD in there, it actually can worsen the situation rather than make it better. So it's a plus and a minus. It's kind of a two-edged sword. It does help with low doses with anxiety, but be careful how much is in there, and stick to your lower doses. We'll talk about what that lower dose means in a minute, about the ratios, but I think that's something that's very, very important. Also, THC in cannabis has been shown to be anxiety inducing. And I point that out, that I was pointing to you earlier about the higher doses. High doses of THC does bring on anxiety. And that's been something that people know a lot about. So again, pay attention to the labels, pay attention to the product that you're using, and it is effective, but we're not using high doses of THC. High doses of CBD reduce anxiety, which is very important. And what people may or may not know is that if you are taking THC and you have a high dose of THC and you're getting the negative effects from it, if you grab some CBD and you take that CBD, it'll take you down, it'll lower that anxiety, it'll lower a lot of the negative effects that you have from THC. And more importantly, in the case of anxiety, a high dose of CBD will really help you. Now, what do I mean by a high dose? That means you should have at least 4 parts of CBD to 1 part of THC to really address anxiety and stress. And the higher that you can get, so you can get an 8-to-1, meaning 8 CBD to 1 THC, or even 12 CBD THC, it's much better for you in addressing anxiety and stress than something that's very high in THC. Now, I say that off the cuff because we all know that CBD, cannabis, is really individualized to everyone's body. And we'll talk about that later on in the presentation, about how we dial it in for your particular body. I'm kind of giving you some general guidelines, but we'll talk about sweet spot at the end of this, and how do you find your sweet spot? How do you find what your ratios are? Well, how do you find out what really works for you? We'll be talking about that later in the presentation, but I'm introducing that concept to you right now. It's out there. What's interesting is a lot of people that are taking anti-anxiety medications have a question of, will that pharma drug, will it interact or will it typically hurt in using cannabis? And there's been extensive research in this particular area. And really consult your doctor if you're concerned about it. And naturally, we recommend you consult your doctor when you're changing any medications at all, especially if you're combining cannabis with medications. Now, people will also say, my doctor's not into cannabis and doesn't recommend it. And that's because they aren't given information to be able to research it. A lot of doctors don't have any information at all about cannabis, so they can't make any recommendations that are out there. Find yourself a doctor that does. And when you got your medical marijuana card, or if you're going to get your medical marijuana card, you'll deal with a medical marijuana doctor. And these are MDs. These are medical doctors licensed by the state of Florida, and they'll be able to help you in this particular area to be able to, again, advise you as to what to do with your medications and be able to help you in this area as well. Now, what happens if you're taking what they call SSRIs? What happens if you're taking Prozac or Zoloft or something like that? Well, it's also been found that there's been very few adverse reactions between cannabis and the SSRIs. So in other words, you probably aren't going to have any reaction. Again, work with your doctor on this. Pay attention to what your body is telling you, because every person's body is different. But you shouldn't, it really isn't something that's a game changer or a deal breaker with respect to looking at using medical cannabis and for anxiety, if that's the medication you're doing. Now, if you're on azepam, you're on warfarin, those types of things, what you might want to do is you also, again, very few interactions between medical cannabis and those particular medications. That's something that you should not have a problem with, and something to take a look at as well. Where you may have a problem is if you're taking high blood pressure or heart rate medications. Since cannabis is distributed in your body through the bloodstream, you have to be very careful about making sure that when you're taking any of those drugs and using cannabis, talk to your doctor, and also talk to your medical marijuana doctor. It doesn't say you can't take them. All it says is you have to adjust the dosage of what you're doing with your particular heart rate or blood pressure medication and medical cannabis. Your medical doctor can work with your medical marijuana doctor to get the formula that really makes sense for you. But it's something that the only time you have to really have a little bit of what I call the red flag is when you're taking blood pressure medicine, high blood pressure medicine, or heart rate medicine. Again, work with your doctors. It does work. I have patients that are on it, but again, we adjust the formulas for the individual patient and for the individual case. So please pay attention to that. Now, one thing I will say is I want to thank everybody for joining tonight. I'm going to break for a second. We're going to jump into a part of talking about cannabis and how it works and how it works with anxiety and stress. But I want to thank you for showing up tonight. And to that end, I want to let you know that tonight's webinar will be recorded on YouTube, and it will be available to you in the future on Marijuana Aware if you go to the follow-up tab. And you'll get an email that will take you directly to a link to our presentation. It'll also give you a copy of the slides. It'll give you a copy of the video. It'll give you a copy of the resources. And you'll be able to access what we call a patient information brochure. And the patient information brochure is a very handy guide. It's a digital brochure. It's a step-by-step guide on how to get a card. More importantly, if you do have a card, on how to use it. It has dosing information. And what everybody loves about it is it has discounts in it. So each of the dispensaries, including Move, has a discount card that's in there. So you'll be able to get discounts from Move if you're looking at that patient information brochure. Now, a lot of people will say, I don't have a card. Is there any discounts for getting a card? And the answer is yes. There's a 10% discount from MMTC. There's a phone number that's in here, the 850 number. If you call and you give them the code MMAW10, you'll be able to get a 10% discount off getting a medical marijuana card. And then also, companies like Move specialize in medical marijuana, and they typically has a higher ratio of THC. A lot of people are looking at trying to find a hemp-based CBD product that's a quality product. And there's a lot of stuff that's been out there. There's a lot of garbage on the market. The question is, what is a quality CBD product that I can rely on? Well, what we did was we worked with the doctors, both at MMTC and a number of other places, to vet a number of high quality CBD products. They're available on mybotanicalwellness.com. Again, use the discount code MMAW10 and you get a 10% discount on CBD products. So we're trying to thank you for being here, provide some discounts, and provide some resources for you for attending tonight. And again, I want to thank everybody for being here. So let's talk about medical cannabis. Let's talk about cannabis, how it works, what it does, and what it can do for you. And that's the important part. So every person has an endocannabinoid system. It's something that it comes with it's part of being human. And a lot of people have heard about it. It's something that was really discovered more when cannabis research was being done, but it is something that's in your body. And what's interesting is our bodies have what they call Cb1 and Cb2 receptors. And if you look a little at the little man that's sitting here, and you'll see the little light dots and the dark dots, you see these are the receptors that are throughout your body. And what's interesting is that endocannabinoid system, the CBD, CBN, THC work like a lock and key as far as human receptors to the endocannabinoid system. What does that do? It does a couple of things. It does a lot of things. It regulates your pain, regulates your memory, regulates your appetite, regulates your inflammation, regulates your mood. And that's what's important. Those are the things that help regulate your anxiety and your stress. And so that's why the endocannabinoid is a very important part of the whole process of using cannabis. Specifically, we'll go here. If you take a look at the Cb1 receptors, they're typically found in the brain and the central nervous system. And if you take a look at the Cb2 receptors, they're typically found in your peripheral organs, in your peripheral organs as well as in your immune system. So these are you hear a lot about Cb1 and Cb2 when people talk about cannabis, and and that's important because this is how your body works. This is how your body regulates itself. Now, how does that work? How exactly does medical cannabis work? Well, your body produces endocannabinoids. And so what happens is your nervous system will say, I have a problem. And so your body knows you have a problem. For example, you have knee pain through inflammation, or you may have arthritis, or in this case, you have anxiety and stress. Your body knows that you have a problem. So what it does is it generates endocannabinoids, and those endocannabinoids are then sent to the Cb1 and Cb2 receptors. And again, that's what regulates appetite, pain, sensation, mood, memory, which we're talking about tonight. That's how your body naturally works to regulate itself. Now, cannabis, phytoendocannabinoids, complement and work with the endocannabinoids in your body. These are what they call, you've probably heard of buds, tinctures, probably heard of CB, THC, CBD, CBN. Those are all part of the phytoendocannabinoids. And they complement your body. They work along with your body. I'm a senior citizen. And as a senior citizen, I'm not producing as many endocannabinoids as I did when I did 20 years ago. So by being able to introduce those into my body, what I'm able to do is I'm now able to provide my body, my endocannabinoid system, the resources it needs to be able to address my particular issues that are going on within your body. And again, it's working with the Cb1 and the Cb2 receptors. There's another product that you'll find out there. They're called synthetic cannabinoids. You probably hear of something called Mirinol. You'll hear about them. You'll see articles about them. What's interesting is a lot of these things are either pure THC, but they really aren't cannabis. They really aren't the cannabis plant. You can't reproduce an apple in a lab. You can't produce a banana in a lab. You can't produce an orange in a lab. You can produce some of the components of it, but you're still not going to provide the whole plant effects, which is what really cannabis is provided. Cannabis has 450 medical components to it. And when people bring in the synthetics, they're only addressing a few of them. I do not recommend synthetics at all. In fact, if you're looking at Mirinol, which is THC only, it's very dangerous to use. In fact, it can only be used under the close guidance of a doctor. So you'll hear about these. I really don't recommend that anybody tries them. I'm mentioning it today so you know that they're part of the ecosystem, but it's part of the ecosystem that you should probably leave alone. Or again, if your doctor recommends it, work with them. But again, I'm not a big fan of pharma labs developing products because they're really not doing the job that they need to do. They're providing only partial products. But again, the endocannabinoids and phytoendocannabinoids are how your body regulates itself and be able to manage itself. Chelsea, you have any comments on this?
No, not you cleared that one completely. Thank you.
Okay, just wanted to, So how exactly does this work? Well, as I mentioned, your brain develops endocannabinoids, and it also relies on phytoendocannabinoids to be able to produce the medication it needs internally to help itself. And what's interesting is a lot of people perceive that when you use cannabis, it goes right into the Cb1 and Cb2 receptors in your body, and in fact, it does not. What it does is cannabis gets stored in the fatty acids of your body, and so think of your fatty acids like the batteries that they're storing the energy that your body needs to be able to heal itself. The neurons in your body, so your nervous system will know you have a problem. So they'll know you have inflammation, they'll know you have pain, they know you have arthritis, they know you have indigestion, they'll know that you have some stressors that are there. And when the neuron sees that particular condition, it takes the fatty acids and turns them into long chain fatty acids. So now what it's doing is it's taking the cannabis, which has been stored there. So it's going to the battery, and what it's doing is addressing the material that it needs to be able to address that particular issue. And then it sends it through the blood system directly into that particular part of your body that needs to be addressed. Now that's important to understand. This is your body producing its own medicine to be able to heal itself. That's important for a couple of reasons. The first reason is no one has ever died from using medical cannabis. And why is that? It's because it's your own body producing its own medicine. Even recreational users that take a lot of it, they may get high, they may have some side effects from it, but they don't die. It's very different from a lot of the pharma drugs that you find out there that are very dangerous and have death effects. But no one, the World Health Organization, has not had one recorded person die from using cannabis, both recreationally and medically. Now, the other thing that this points out is something that's really interesting. You'll hear people talk about the entourage effect. The entourage effect in cannabis is you take it for one reason, but what you find out is it also helps you with some other problem. For example, my mother takes medical cannabis because she's been diagnosed with breast cancer. And I should say this was done 4 years ago, and she's still with us. She's still on the face of the earth and walking around. Now, what she found out when she started taking medical cannabis, she went to the doctor for her glaucoma, and her glaucoma was gone. And when she talked to the doctor about the doctor said, "What are you doing? Your glaucoma is gone." She mentioned she was taking medical cannabis for her cancer. And what ended up happening, interestingly enough, the doctor said, "Yes, that absolutely works." So my mother got rid of her glaucoma, as well as she's put her breast cancer in remission by being able to use medical cannabis. And people have many experiences like this. They'll take it for inflammation in their knee, and they'll find out that the pain in their shoulder went away. They'll take it for a pain in their shoulder, and they'll find out they sleep better at night. They'll take it for anxiety and stress, and they'll find that their overall body feels better. That pain in your foot or whatever is heavy. Your body, the neurons in your body know where your problem is. You don't need a doctor. The doctor doesn't need to tell your body where your problem is. Your nervous system will tell itself where your problem is. So all I'm saying is this is where the entourage effect comes in here, and that's why it works. It's a very important slide to understand because it's your body producing your own medicine, helping yourself, which is really important. So let's dig down a little deeper about what is medical cannabis. It's CBD and THC. Chelsea, tell me about CBD and THC.
Well, CBD, for example, is from the hemp plant. CBD is non-psychoactive, does not contain THC, and is known for its super ability to relieve anxiety and reduce pain in many people, as well as inflammation. THC, however, does have the psychoactive effects. It also contains CBD, as well as many different terpene profiles, depending on the strain. THC comes in strains hybrid, sativa, and indica as well.
Yeah, what's interesting with cannabis, with CBD, CBD is both in the marijuana plant, and it is also in the hemp plant. So it's something that's in both, okay? People have a perception that it's only in hemp, but it's not. It's in both. It's something that's found in both plants. And THC, tell us a little about THC.
Well, like I said, the THC has those psychoactive abilities. Many different strains as far as where THC can be derived. It can be in the form of a hybrid, a sativa, or an indica.
Right. So THC is also part of the family. We'll show you in a little bit where THC is extremely helpful. THC is not bad. THC is very important for things like pain management. It's very important for, again, for anxiety and stress. In lower doses, it's extremely helpful for anxiety and stress. But in higher doses, that's where that psychoactive effect takes into play. And that's where the psychoactive part comes into play. This is a CBD, this is what they call the famous CBD wheel. So when you take cannabis and you break it down, it has 450 medical properties. These are kind of some general components that they found that are in there, some of the benefits and the conditions for medical cannabis. You want to chat about a few of these, Chelsea?
Sure. I'll dig into probably two of my favorites, one being CBG, the other one being the CBC, both of which are incredible on many different levels as they tap into the endocannabinoid system. Any kind of, like Marc was saying, our nervous system knows the problems our body has far before we know what is going on. And so having introduced any form of CBD, whether it be a full spectrum or one of these isolates, definitely strikes to whatever may or may not be going on within the body. A lot of antibacterial, of course, that was the big talker during COVID, that CBG has the antibacterial properties within it. And that was something that cued me in, and where it became one of my go-tos regularly, just for prevention of infection. CBD, or CBC rather, is another one of my go-tos when I'm looking for specifics on CBD. And this is because it relieves pain. All of us have some form of pain, whether it be mild, moderate, or extreme. CBC is a great way to reduce a lot of the inflammation that is causing that pain within the body. When you dig deeper in these and look at the terpene profiles, they can also be coupled with foods that you can add into your diet to enhance the effects as well.
Right. So what's interesting is you look at the different things, like these are different components. And by the way, as I mentioned, there are 450 medical components. We're only putting a few of them on the board here. You'll find things like T8, like Delta 9 helps relieve pain. So does Delta 8. There's a lot of discussions about those particular components by themselves. But when you combine the THC with the CBD, in essence, 1 and 1 is 3. That's what brings on not only the entourage effect, but it also accelerates the effectiveness of cannabis. CBD by itself is okay for pain when it's reducing inflammation. CBD by itself doesn't really a great pain reliever. But you put some CBD with some THC, it becomes fantastic for pain. I use it for that particular condition. And so what you'll find is that each of these has different components to it, but mixed together, what happens is you end up getting into something that really, again, 1 and 1 is 3, and that's what's important. Now, the other thing to pay attention to is terpene profiles. We're going to talk about terpenes in just a minute, but also every person's body is different. And we'll talk about that in a couple of slides. But you're going to find that as you use medical cannabis, different components of cannabis can help your body based on your own profile and based on what you're trying to interact with. Let's be specific for a second. There are different cannabinoids that are out there. You talked about a couple of them. Do you want to talk about this slide, Chelsea?
Yes, I was checking into, forgive me, looking at some of the Q&As. As far as terpene profile, we're on common cannabinoids.
Yeah, that's right. We're on common cannabinoids. Yeah.
Okay. Sure. Going back into, well, CBC, the anti-inflammatory, which is one I mentioned as far as reduction of mild to moderate pain, and that antibacterial, antifungal. This also, what's interesting about CBC was this stimulates bone growth. For women of a certain age, this is very important as we start to lose bone mass. So CBC becomes important to incorporate into the everyday wellness ritual that you may have for that very reason.
Yeah, the THCV also does a lot of that as well. Helps with bone growth.
Correct. Yes, that was exactly where I was going, because when you look at that and go straight over, THCV is the best one to couple those two with when looking for that bone growth, as well as anti-inflammatory properties.
Sure.
CBN is a really excellent one to couple, say, with an indica if you have difficulty sleeping. This one aids in that rest and relaxation. For anyone with stress and anxiety, CBN is also a very good choice.
Yeah. So, I mean, we're just taking a few of the components that are there. It's not again, there's a lot more medical components, but a lot of these help with inflammation, but also a lot of these will relax you. And that's why I wanted to point these out. A lot of people ask about what components really make a lot of sense. Now, when I got involved in the industry, this was about 8 years ago, all I heard about was sativa and indica. And I know one of the questions is, what is a hybrid? So let's answer that particular question. Let's start by, why don't you tell us a little bit about what a sativa is and an indica is, Chelsea?
A sativa is a strain that is going to activate you, stimulate you, bring on positivity, happiness, a better attitude. For most people, that is what a sativa brings to them. An indica, however, is something that people use to sleep, to relax, to come down off of an anxiety attack, panic attack, should you be prone. An indica is good for overall rest and relaxation. Hybrids tend to be a split between the two. When you look at hybrids, it's very important to look at the science behind that hybrid. Which terpene profiles are most readily available in that particular strain? When you look at those terpene profiles will lead you to know whether it's a hybrid leaning towards sativa or a hybrid leaning towards indica. And so the best way to determine which hybrid is best for you so that you can have that mix and that balance is to determine why you are in the first place using it and what result you want to achieve.
Yeah, what's interesting is when you ask what is a hybrid combines both a sativa and an indica together. Where maybe 20 years ago you'd get one or the other. Now what's happening is, especially the last 6 years, what they've been able to do is mix and put together the CBD, the indica, and the sativas together into what they call a hybrid. And then based on the amount of either CBD of indica or sativa, that's where you get what they call the leaning. Leaning means it has more of the sativa properties, meaning it's something that energizes you, or meaning it's going to relax you, meaning that's what the indica is. So hybrid just means that you've taken and they've combined, in essence, it's kind of like a salad. They put together a couple of different leaves to be able to provide the product that's out there. And more importantly, there's a lot of people who've paid attention to terpenes, especially the last 8 years. Terpenes have become really important. We're going to have a couple slides on terpenes in a minute. But terpenes has a lot to do with of how this actually helps you. I know that when I first got involved in medical cannabis, it was because I had an automobile accident, and I had ended up with 7 herniated discs in my neck and 2 in my back. And when I went to the medical cannabis, when I went to the dispensary for the first time, they had a profile from my doctor. He had a recommendation. I talked to the bud tender, and as you can see from behind me over here, there's a whole bunch of products that are out there that came over and said, here's the products that I recommend for you to use. Now, on my first visit, I was kind of shy and timid about this. So I took the products, went home for a week or 2, tried them, came back and basically gave some feedback. So we made some changes. But I asked then I got bolder and I asked the question, how do you know out of all these products, which one to use? And they said, it's very simple. We looked at the condition that you're trying to address and we matched it to a terpene profile as well as a hybrid that would address your particular condition. And it dawned on me, this is medication. This isn't just a plant in the backyard that you grow, roll up and go smoke. This is something that is put together very specifically to help with various medical conditions. And they've been put together for that for a reason. So terpenes are important, so are the strains. And I think one of the most important things to understand is every person's body is different. There's a question of what should I take? What's the formula? Well, that's a pharma approach. Take 2 pills and call me in the morning kind of thing. That doesn't work for medical cannabis. As we all know, every person's body is different. What do I mean by that? We have friends that take 1 drink and they're done for the night. We have other friends that could drink the whole bottle and they're just getting started. It's because their metabolism, their bodies are very, very different. We have some people that can drink light things like vodka and gin. There's people that can drink things like darker things like bourbon and scotch. I'm a darker drinker kind of thing. Can I drink vodka and gin? Yeah. But what it does is I do bad things. I stay away from those things. I really prefer the darker things. And I know which ones I like, whether I like an umbrella on a drink or not. And it's come from me just being able to experiment and know what works for me and what doesn't work for me. Well, cannabis is the same way. Cannabis, some people can take a very low amount of THC and get high, and some people can take a lot of THC and not get high. Vice versa. There are some people who take a very low dose of CBD and it doesn't affect them, but they'll take a low dose of CBD and they get high. So we have to really find out when we're talking about how do you find out what your sweet spot is. We do a little bit of experimentation, and we'll talk about exactly how to do that. We start with the 1-to-1 ratios. We find out what your body's susceptible to, how it works, and what's the best thing for you, and then we adjust those formulas to be able to address that. And one of the things I love about the Move products is they put together pure CBD products, they put together pure THC products. So when you're trying to find that ratio, you don't have to buy another product. There's a lot of dispensaries, you got to buy product after product to get what they call the ratios right. You don't have to do that. With Move, it's very easy. You just take one dropper or 2 droppers versus another one with 1 or 2 droppers, and you're able to do that dosing that's correct. So we'll talk a little bit more about it as we go along, but pay attention to your body. The main thing I'll tell you is the best advice you can get on using medical cannabis is your body. Your body will tell you what works, it'll tell you what doesn't work. Pay attention to it. And this isn't like a race where you're trying to put as much as you can. It's not like going to a pool party and grabbing the 151 Bacardi. But this is something where if you want to go have a good time, you're going to probably grab one of those umbrella drinks and just go enjoy it. It's that type of thing. There's a whole raft and a whole world of potentially great products that can help you. Take the time to enjoy them and take the time to be able to experiment with them. And if you get it right, trust me, if you get it right, you get your life back. Let's talk about terpenes for a second. You want to take this slide, Chelsea? You want to talk a little about what terpenes are and how they work?
Yes. Terpenes really and truly are one of the defining factors of which strain dominant each plant is going to be. Each terpene plays a very specific role in that plant, from the smell, oftentimes the color, the oils it produces, as well as the effect it has on the body. Many of these terpenes will cause happiness. Some will cause sleepiness. Some will completely relax you, while others, just want you to stay awake more often than not. These are very fragrant. Terpenes are very fragrant. If you limonene, for example, very citrusy flavor that you'll smell each time. Pinene is another one. Very.
Over here, we had a question. Let's make this a little bit easier. We had a question about what terpenes are best for strength and anxiety. Here you go. Help me walk through a few of these.
Yes, so linalool is one of the best ones. This purple one right here, a very floral aroma of flowering spices. It has that lavender in it, and it does result in a very relaxing state. Pinene is another one for relieving anxiety. And I believe it's caryophyllene. Caryophyllene is the other one that's excellent for relieving anxiety.
Right. Those are very good. Now, I want to put a caution a little bit on the pinene. Pinene is good for anxiety, but also it also helps you bring back a lot of memories. So if you're a PTS patient or something in that particular space, I would stay away from a medication that has a lot of pinene in it. It's not something I'd recommend. Linalool is just like lavender. It's something that's great for you. It really helps us. Again, it's something that will relax you. Again, caryophyllene is something that works very, very well. I've also found, and the reason I put these on here is limonene has been, although it doesn't say on the slide, it's really good for anxiety and stress. It's basically like lemon. And a lot of people find that lemon flavor, that lemon aroma is something that gets people to be able to relax and be able to, it really helps quite a bit. And the other one that is really interesting is what they call myrcene. Myrcene is the one that's in the middle. It's the one that's in the orange. Not only does it help with pain relief, it's a great antibiotic, but it's also something people find in things like mangoes, people like basil and that type of thing. Again, that's one of those things that does have some relaxing properties to it. Stress relief, it falls into that category. And I think, again, James, I think you're asking for what are some of the best strains or terpenes. I'd recommend you take a look at these. When you go to the dispensary or you're researching online, you can ask the people behind the counter, what is the terpene profile of the product that I'm making? Now, there was a question that is in here. Let me see. That was asked. Here we are. Carl. Carl asked a great question. Where do I find the terpene profiles of the Move products? You want to take that one, Chelsea?
You are going to be finding those very soon. Our team is developing a new platform that's going to have the transparency of these terpenes, of these profiles. Now, when you do purchase or look at different strains, say flower, for example, you can look at that flower. I think even Google may pull it up and you can find some of the profiles. My answer always right now is definitely go on to strain print. There's a lot of conversation. A lot of people go plug what they're suffering from in there. They can track the uses of their medication. They can also see what has helped other patients. And there's a discussion within that that may also reveal what some of these terpene profiles are.
Right.
But as far as Move, those will be coming to our website and to print very, very soon.
Right. And then also, if you take the product, when you're at the dispensary, if you take the product, on the side of every product is a barcode. If you take that barcode and you scan that barcode with your phone, and the bud tender can help you do that, or he'll do it with his phone, it'll pull up what they call the quality report for that particular product. And in there will tell you the terpenes that are in that particular product. So before you purchase, you can know which terpenes are in the products. Again, the bud tender at Med will help you be able to do that. I haven't found, when I go into the Move store, there's something on the wall that explains that. I think that's what Chelsea is talking about. But you can find what the terpene profiles are by talking to the bud tenders. And then also, again, let them use their phone or your phone, and you'll be able to pull up the reports for that particular product. That'll show you the quality reports, and they'll show you the profiles that are in there, something that's there. Okay. Now, I want to go back a slide for a second, and that is, we passed over something very quickly. When we talk about terpenes, what are they? Well, what's interesting is your endocannabinoid system acts as the highway to carry the cannabis and the terpenes to that part of your body that needs to be addressed. The anandamide is something that's the driver. It's the thing that says we have a problem, so push it out to that particular part. CBD and THC is the passengers that are traveling through your bloodstream. But the terpenes are really what navigates. It's the thing that brings home the medication that helps you with that particular condition that's out there. So the terpenes are very, very important. And as I mentioned, in my particular case, I actually, when I go to dispensaries now, I actually spend a lot of time paying attention to what products I get, what are the terpene profiles. I just got a delivery today from Move of some products. And prior to purchasing them, I actually went in and actually was able to check out what the terpene profiles are for the condition that I'm trying to address, which in my case is inflammation and pain management. Again, I mentioned the herniated discs in my neck. 7 of them is no picnic, that's for sure. And then the other issue that I have is I have had a left knee replacement, so I have to worry about inflammation. So I pay a lot of attention to not only the cannabinoids, but I pay a lot of attention to the terpenes that are out there. So that's kind of how the whole formula works. I think that's important. That's a bit important to understand. Now, let's talk about what strains are best. So people say, what should I be using for strains that are out there? You want to tackle this one, Chelsea?
I'm going to let you tackle this one.
Okay. So when people say what strains are there are different strains that you'll find. And again, when you go into the dispensary, especially when they talk about flower, they'll talk about the different strains that are out there. I'm not going to run through each one of them because we're going to provide for you this slide and part of the documentation and the resources to be able to see. But you'll see that Jack Herrera, Girl Scout cookies, things like Granddaddy Purple, OG Kush. They're all products that be able to help you quite a bit with not only anxiety and or strain relief or stress, but something that'll be able to help you quite a bit in that particular area. Again, I'm providing this information. Excuse me?
String print is also going to be a great one to cross-reference these different products on, because you can definitely read what other patients are saying about each that have used them.
Right. We'll talk about what string print is in just a minute. It's actually an app that you can get from Move, and what string print allows you to do is to be able to pay attention to what you're dosing, help you with your dosing, and then also you can see what has worked for other people with your condition. So you can see things that you might want to try for your particular area that's out there. It's a very useful app that really helps you be able to hone in on what's there. But again, these are some, so when you're looking for just strains by themselves, these are some pretty good strains and strains that are out there. Now there's a question by Kathleen, can you buy just terpenes? The answer is yes. There are places online you can go to pick up terpenes by themselves. Now, terpenes by themselves won't necessarily help you. In other words, you need to have something that works with the terpene to help trigger it. And that's what's important. The cannabis works with the terpenes. Again, it's that whole what they call whole plant effect that's out there. And again, if you Google terpenes, you'll find there's a number of vendors that will sell products that are out there. They're mainly used to be able to be boosters, or to be able to augment, or to be able to complement what you're doing. But again, if you just go buy a terpene by itself and go try it, it's probably not going to help you very much. You need to use it in conjunction with something else.
No, and through the Department of Health and many different ways, we are not able to produce or sell terpenes by themselves.
Right. Most of the sellers of terpenes are people that are selling across the United States. Some are reputable vendors and some of them aren't. So be very, very careful when you look at terpene-only vendors.
Yes.
The regulations here in Florida don't allow the dispensaries to sell terpenes by themselves. They are available. I don't want to have you feel that they aren't, but I would be very cautionary about the vendors that are out there.
Well, and one thing to know is
the dispensary about the products you need and get the terpenes with the cannabis, because that's really going to be the key, is that 1 and 1 is 3.
Yeah. And terpenes are very sensitive and very perishable. So the likelihood of them surviving a cross-country trip are very unlikely.
Right. And that's why you have to be very, very careful with this. But again, I'm just making you aware that they're there. But again, it's not something I'd pursue. It's something I'd much rather go to the dispensary and have them put together a product that gives you everything that you need to be able to address what's there. So that being said, what's interesting is when I got involved in the business 8 years ago, I was thinking, everybody's not going to be sitting on the front porch kind of smoking a fatty. In 8 years, there's been a lot of progress on the different ways of what they call standard dosing forms, how you take it and how you work with it. You want to walk us through a few of these, Chelsea?
Definitely. So you have, these are our Move products, all of which you will see in the store. We have many more. At the top left are Wana soft chews. These we have in indica, which is a blueberry. We also have a hybrid and a sativa. These are 10 milligram chews and can be easily cut to microdose. These are vegan, made with pectin, so they're not going to melt in the summer sun. We also have our chocolate. We have our milk and dark chocolate, as well as lozenges available as far as edibles. We have our tinctures, our RSO tinctures, our CBD tinctures, and THC tinctures. The patches are also available. These are
Your dog loves you, Chelsea.
Do what?
I think your dog loves you.
I'm sorry, guys. I am so sorry. Every time I speak, she thinks I'm talking to her and she wants to come get on camera, have her cameo. Oh, goodness. She is a CBD dog, so very healthy. She's a proponent of. But our evolved transdermal gel and our patch have our patented end caps technology. This has our it's nanotech, meaning that this is absorbed into the bloodstream. It bypasses digestion, and you do get that dosing each and every time. Capsules are an excellent option, as well as the shatter and other products that are available.
Yeah. So let's put up this slide. This kind of help a lot of people understand the different options that they have, because you'll hear a lot about tincture drops, edibles, inhalation, sprays, flour. You want to talk about the pros and cons of these? Or you want me to take it?
Well, pros and cons are going to depend and vary person to person, really. Your tinctures and your sublingual drops, oftentimes people have a more difficult time measuring these. With the edibles, these are fat soluble. They are best absorbed when taken with something fatty. For example, say a little bit of peanut butter, coconut oil, and avocado. Otherwise, people will sit for 45 minutes and feel nothing and pop another one. And the second they take a bite of food, become overwhelmingly medicated to an uncomfortable point, unfortunately. Capsules, oftentimes individuals with digestive issues have issue with the capsules, putting anything on their stomach, really. Otherwise, these are a great kind of discreet way to medicate throughout the day if need be.
Yeah, I think one of the things that's interesting is a lot of people ask the question, what's the difference between a tincture drop and a capsule? And I think it's important to point out, when you use a tincture drop, you put that underneath your tongue, and what happens is it gets absorbed directly into your bloodstream almost immediately. So if you look at you look at what it says before onset, it takes effect, it says 15 to 20 minutes. In my case, when I take a tincture drop, it takes about 20 to 25 minutes. It goes directly into your system, and it goes directly into your liver and your bloodstream. Capsules go into your stomach. And when they go into your stomach, about 20% of that capsule is absorbed by the lining of your stomach. It does take longer. Because of that, it takes longer to have the onset. Could be 30 minutes to 2 hours. But because of that, it also lasts a lot longer. Could be 30 minutes to 4 to 5 hours, as long as 8 hours potentially. So capsules, which a lot of people are more comfortable with because that's what they've been using for years, is definitely an option that's out there. It just takes longer to work. Tincture drops work quicker, but again, they won't last quite as long, maybe an hour less, but they're very, very effective. A lot of people start with tinctures rather than capsules because they get, again, because they're not losing 20% of the medication, they're getting more bang for their buck, the best way of putting it. And it's there. So, why don't you want to take it? Kelly?
Sure. I think we're on to the topicals. The topicals are excellent for localized pain. Let's say, for example, you're leaving the gym and have some soreness in the muscles. This is excellent to rub directly on. Like I mentioned, ours has our in-caps technology, so it's absorbed directly into the body. Transdermal patch, much the same. This is a put it on and forget it for 3 days. It's a full 72-hour patch. It can be placed on, taken off. The timer stops the second you turn it off. Both of these are a microdose, so it's unlikely that you will have hallucinating effect or any psychological effects whatsoever from these. Spray is also a microdose, so very small dosage, and it's an immediate onset. Flower inhalations, both of those, smoking, as we know, is the perfect avenue. It is an instant relief should you need that relief to those. And then suppositories. Suppositories are not something that we have in our office or in our dispensaries. However, some may. These are excellent for people with, let's say, for example, colon cancer, but need to be well educated prior to using.
Yeah, and suppositories are mainly used for in digestion, internal issues. I do want to point out a couple of things. First of all, I want to touch on topicals for a minute. They work immediately. And in my case, for example, where I have herniated discs in my neck, when I get up in the morning, I typically, I can wake up in the morning with a level of pain of between a 7 or an 8, which I did initially right after the accident. I've learned over the years how to manage that. But what's interesting is if I take the tincture drop, which I have on my nightstand, when I wake up in the morning, that's the first thing I touch. For myself, it takes 20 to 25 minutes for it to work. I don't want to live at a level of pain of 7 or an 8 for that point in time. So what I typically do is, in my particular case, what I do is I grab a vape pen and I take a hit off a vape pen, and literally within 1 or 2 hits, within a minute or two, that pain level drops from a 7 or an 8 right down to a 1. So you can mix and match each of these methods. I can use my vaping, which typically will only last between 2 to 6 hours, but it gives them that immediate effect and give it time for the tinctures to be able to kick in. Now, the topicals are interesting because if you don't like vaping, you can take and you can wipe the topicals on that particular part of your body, and again, it gets absorbed not only into your skin, but the advantage of the Move products is they're transdermal, which means it goes right through your dermis and goes right into your bloodstream almost immediately. That's one of the advantages of Move products. The topicals, if you don't like vaping, I know there are times where I'll actually take and use the topicals as opposed to a vape pen, and it has the same effect. You can almost immediately feel the pain relief that's there. When I had my knee surgery, and again, you have an artificial knee put in, it's a lot of pain. I use topicals quite a bit, and actually I didn't put it into the wound itself, but I use it around the wound, and it helped me relieve a lot of my pain, and it did that immediately. So it's something that you may want to pay attention to, and it's something that's very, very effective. You can mix and match these dosage methods based on your lifestyle, based on what you do, and based on who you are. Now, I'm gonna touch on something, and Chelsea, hopefully you'll back me up here. I love transdermal patches. You've been talking about something called microdosing. People have realized that just like when you hear about diets where people will eat maybe 6 or 8 times a day rather than maybe two or three big meals, same thing works for cannabis. If you can feed your body just a little bit of cannabis during the day, it really helps you self-regulate during the day. Move is unique in the market in that they have transdermal patches that last 72 hours. That's 3 days. And I just love them because I can put on a CBD patch or I can put on a THC patch. And then what I'm able to do is I'm able to actually, if I use a CBD patch, I can regulate the amount of THC I need to be able to manage my pain, or vice versa. If I'm using a THC patch, I can regulate the amount of CBD to regulate the inflammation. The patches last for 72 hours. One of the fans, I'm a huge fan of the Move 1-to-1. That's 1 part THC, 1 part CBD. Put that on, and for the next 3 days, you're good. And the only thing you need to do is if you need to address your inflammation or if you need to address your pain, you can be able to do that through again, through vaping or through the different tinctures that are out there. But transdermal patches are very, very effective. You want to make a comment on that, Chelsea?
I keep a transdermal patch on at all times. They are definitely my go-to. I like to know that I have a constant flow into my body. It is not going to be your go-to to relieve an anxiety attack or reduce major pain, but it is going to keep the endocannabinoid system active and awake at all times.
Yeah, and what it does is it provides that balance that's out there that if you have pain, especially if you have, for example, you have a CBD patch on, then it's just a matter of just adjusting the CHC to be able to adjust that pain. And it makes it a lot easier to do that. You're not trying to figure out what the formulas are or things like that. It makes it a lot easier. Same thing with the THC. If you have a THC patch on, you can adjust the CBD to be able to, again, manage the inflammation that you have out there. And also if you have any potential effects from that. Again, I'm a huge fan of the 1-to-1. But what I love about them is microdosing for 72 hours. It makes it so much easier to be able to use cannabis by being able to use those patches that are there. So let's talk about something that is kind of near and dear to everybody's heart. how do you find that sweet spot? How do you figure out what's there? And this is something that I think is very, very important. If you can figure out what works for you with respect to with respect to medical cannabis, this is where you get your life back. This is where you get the most effect in the product that's out there. Now, you want to talk to this? You want me to talk to this with Chelsea?
I'll just say that finding that sweet spot is a trial and error and a unique journey for each and every person uniquely. If you go in for the first time and you are given products that do not match with your system, please do not give up. Go back, explain to the med tender what your reaction to that certain product was, and begin guiding back into a path that's going to work best for you.
Yes. Now, what's interesting is when you say how you find your sweet spot, my recommendation is you start with a one-to-one. So you start with a one-to-one product and figure out what your regime is. So for example, in my particular case, I'm trying to manage pain in my neck and in my knee. Now, pain is a constant in my body all day long. So not only do I use it in the morning, my regime is morning, early afternoon, and evening. Because if I skip, for example, if I decide to skip an evening, the pain comes back. These products will last anywhere from 6 to 8 hours. But if that 8 hours happens to be 10 o'clock at night and I'm sleeping, it'll wake me up. The pain will wake me up. So what I need to do is, in my case, I use a regime all 3 times a day. Again, hence why I love Transdermal Patches. So you got to find out what works for you. Some people do morning and evenings. By morning meaning before breakfast or at breakfast or at dinner or just before dinner. Again, you got to figure out what works for you. But again, using a little bit during the day. So if you're supposed to, if your regime, if your medical marijuana doctor suggests using 25 milligrams or 50 milligrams, you can use like just a portion of that during the day. That helps you regulate that's out there. Titration means, do you raise up or lower? Now, the important part is I recommend starting with a one-to-one. Start with a one-to-one product, use it for a couple of days, like 3 or 4 days, maybe even 4 days, and see how it affects you. If you don't get anything from that, don't quit. What you may want to do is you may want to increase from 25 milligrams, which is the first line that you see on the dropper, to the second line, get you to 50 milligrams. And then see how that works for a couple of days. And if that doesn't do much, go to the third line, which is 75 milligrams. What will happen is that once you probably get to that particular level, and again, figure out whether you're going to do it once a day, twice a day, or 3 times a day, depending on your condition. Again, that's your condition in your body. What you'll find is that probably when you get to that 75 milligrams, you may get some, because even though it's one-to-one, you may get some euphoric effect from it, depending if you're susceptible to THC. In other words, if it's something that your body is very susceptible to THC, you'll begin to affect it. At that particular point in time, you can then add more. You can drop down the amount of THC and increase the amount of CBD. So that's what they call the ratios. So instead of being 1-to-1, you could go 2-to-1, 2 CBD to 1 THC, 4-to-1, 4 CBD to 1 THC. And then you'll be able to find that ratio to be able to dial it in to exactly what you want. Now, what's the best way to do that? Recommend journaling. Write down what you're doing. Find out how well it works. Find out what your dosages are, what time of the day you're using it. Do you eat it on an empty stomach or a full stomach? I think as Chelsea had mentioned earlier, if you use a full stomach, sometimes you'll find it kicks in much quicker than with an empty stomach, and vice versa sometimes. Find out how long your last dosage lasted. When you took that dosage, did it last 8 hours, 4 hours, 6 hours? And what's interesting is when you keep a journal, it helps you be able to figure that out. Now, Chelsea's going to talk to you about something called Strain Print. And Strain Print is an app that helps you do that. It basically does all those things in an app, and at the same time provides information from other users about what works that's out there. But again, your sweet spot's pretty easy to figure out. If you start with a 1-to-1, just raise up from 25 to 50 to 75 milligrams, figure out how it affects your body. And then again, if you start getting a euphoric effect, drop that down and then increase the amount of CBD, and you'll be able to figure out, you'll be able to dial in what's there. How long does that take? It could take it could take 2 weeks. It could take a month. I know in cases of Parkinson's patients, it may take as long as 3 months. In arthritis patients, it could take as long as 3 to 4 weeks. again, those are situations where you need to almost bombard your body to be able to get the inflammation down. There's so much inflammation that your body really needs some help. But by being able to keep track of what you're doing, paying attention to how your body reacts to it, you'll be able to adjust the different things that are out there. Now, there's a couple of questions we may want to answer. I'm going to pick up a couple of them, Chelsea, if you don't mind.
Sure.
I'm born, bred, and raised in California. I just got back from visiting my mother in the San Francisco Bay Area. You mentioned, John, you mentioned you're a card holder heading to San Francisco. First of all, California is a rec state, which means you don't need a medical marijuana card to buy cannabis. Now, you can take your card from Florida, provide it to the dispensary in California, and what happens is you don't pay tax. So the answer is yes, they recognize Florida medical marijuana cards in California, and what it saves you is that 35% tax, which is a nice thing. Now, what happens is if you're from California and you have a medical marijuana card from California, Florida doesn't recognize it. So at least not right now. But I thought I'll let you know that the answer is yes. You can use the card to be able to buy. It helps you with your tax that's out there. What I don't recommend you doing is putting medical cannabis at all in your luggage or carrying it out there. You're going to walk in and when you go into the airport, you're in federal space. And although the TSA has actually had a statement that said they're not looking for cannabis products, they're not looking for THC, and they're not looking for, they're not purposely looking for it. Those sniffing dogs are looking for more like guns and bombs and things. However, if they find it, they have to do something. It's forcing a TSA agent to do that. So what I do is I classically will figure out when I'm going to California, I have some dispensaries out there, and if you need the names of some of them, send me an email, I'll give them to you. And especially in the Bay Area, the Apothecarium, for example, is a really good one. Blunt is a good one. And what I do is the minute I get on the ground, first thing I usually do is go to a dispensary and pick up the products that I need while I'm out there. So I don't recommend traveling with it. So hopefully that answers that question. We had a question about what I use. It looks like when I use sativa, it makes me more anxious. And that was from an anonymous question. The answer is yes, it will. That's what sativa is all about. It's an energizing thing. My recommendation is to use a hybrid, to use something where you have a ratioed product, where you're actually put more CBD into it. You can still use the sativa part of it, but really use a hybrid, use a sativa in conjunction with a CBD product. And again, get higher the CBD product will lower that anxiety, but you'll still get the same positive effects from the sativa product that you're using. You want to tackle any of these, or you want me to just keep going?
While we have one from Kathleen, the different strains have more or less of these components, terpenes and cannabinoids. Each strain is going to be unique to the plant it's derived from. So that's why it's important to scan the SKU or ask the med tender what is the dominant strain, what are the dominant terpene profiles within it. So yes, each strain has more or less terpenes and cannabinoids depending.
Sure. Kimberly asked a really good question, and so let me address that one. It says, your question is, the VA is against medical cannabis. Is it worth his benefits since it's not federally approved yet? This is a huge subject right now. It's a lot of controversy in Washington, D.C. It's a lot of controversy with the different veterans groups that are out there, whether it's Veterans for Cannabis, whether it's Weed for Warriors, all the different groups that are out there are fighting to be able to have veterans be able to address cannabis. What's interesting is certain VA hospitals will actually, the doctors at the VA hospital cannot recommend and they cannot approve medical cannabis. Otherwise, they lose their license and they don't practice in the VA, so they're not going to do that. But I have worked with different VAs that will actually tell the patients, go see this medical marijuana doctor down the street and talk to him. I can't give you information. So they pass the buck off to a medical cannabis professional. if you are using medical cannabis, will you use your benefits? That really depends on the VA. Some VAs are absolutely strict on it. Most are, I have to tell you. Some are more lenient that are out there. The best advice I can get you is to talk to the various, the Grateful Veterans Group, for example, Veterans for Cannabis, Weed for Warriors. Talk to those groups. They can give you the best advice of what's out there to be able to help you with that particular situation. It's a very touchy issue. Veterans very much want cannabis to be part of the equation. And I know that, for example, just take the state of Texas, one of the reasons why PTS is one of the conditions in Florida and will be one of the conditions in Texas is because the veterans basically put pressure on the legislature in Texas to make that legal. Now, what they haven't been able to do is put pressure on the VA to be able to address that situation. That is a political football that's been kicked for a number of years and is being kicked. And anybody who's dealt with the VA understands that that's something that's unfortunate with that particular institution. But talk to your Weed for Warriors, talk to your Veterans for Cannabis, talk to your Grateful Veterans, talk to your different groups that are out there. If you need contact with any of those, please send me an email. I'll be more than happy to put you in touch with Jeff or with the different Joshua and the different people that are in those organizations. They can help you walk through those and what can and can't be done. And they have a lot of experience with the different VAs that are there. I'm not trying to not answer your question. I mean, the answer to your question is it's federally illegal. The VAs have to take that approach. But again, a lot of the VAs understand the situation. They've seen the benefits of it. And some of them are a lot less lenient. And I know there's a lot of veterans groups that have had a lot of experience dealing with the VAs, a lot more than myself. So I'm going to kind of refer to them. And if you do have a question, Kimberly, send me an email. I'll be more than happy to put you in touch with some people that have had a bevy of information and can really help you walk through that. And I hope that answers your question that's in place. One of the questions that came up, when Marcia asked the question, MUV, what does MUV stand for?
Absolutely nothing.
No, it's not an acronym for anything, huh?
No, it is not an acronym. And the U has the 2 dots. So it's just 3 letters that look very happy.
Cool. Okay. So it's more of a symbol than it is a message. Is that right?
And if you look at move, say if you were to type it into Google, you'll see many gyms and athletics and health and wellness clubs that are also MUV move. So ultimately, you know, when I look at it, you know, I think it's our chance to get to move again, whether that be away from the stress and anxiety, away from the pain. We're moving away from something. So while it means nothing, it means quite a bit to me.
Yeah, cool. John asked an interesting question. Can CBD help with neuropathy? I will also point out that next week we have Dr. Wiener is going to be on, and we're going to be talking about fibromyalgia, but she'll also address neuropathy as well. So join us for the webinar next week. That's a shameless plug for our webinar series next week. But the answer is yes. CBD can help with neuropathy because it helps reduce, in many cases, a lot of the inflammation, and it provides some medical components. But it's also important to use CBD with a little bit of THC to address neuropathy. So I'm not going to kind of steal the thunder for next week, but the answer is yes, and there are formulas to be able to help with that. And again, next week we'll be able to answer more, get more in depth, and get you more information on it. But the answer is we'll head you in a positive direction of yes.
Yeah, and the transdermal gel in interim is a good option to place to use.
That's a good point. Lisa asked the question. Do you want to take that one or you want me to take that one?
Autoimmune, bad lupus, panic attacks. I would definitely recommend going back a few slides when we were discussing a lot of those terpene profiles and look for those strains that are dominant in that linalool, the pinene. Yes, thank you. Very good. You know, as Marc was saying, limonene, for example, but look at those strain specific and find those terpene profiles, as well as finding foods that are found. Limonene an easy one. Lemons, limes, those are very fragrant, very vibrant, and limonene is where you can find that terpene as well. So look at those foods you can also couple with your medication.
Good. I hope that's a good answer for you. Mark asked a question. To get the symbiotic effect of CBD and THC, they have to be taken at the same time, or can they be taken 6 hours apart and still get the same effect? The answer is, if you want the symbiotic effect, they have to be taken at the same time. And by the way, most products have both CBD and THC in it, or most medical recommendations have a recommendation of a certain amount of THC to CBD that's in there. You'll find that CBD complements THC. It's like a 1-in-1 type of thing. It helps make THC much more, how should I say, it helps the pain relief part of THC work a little bit better. And candidly, THC helps the pain, the inflammation part of CBD work better. So really, having them work together, you'll find the symbiotic effect. If you take them parallel, and you take one and then take the other, you really won't find that symbiotic effect. It doesn't just like hang in there. After 6 or 8 hours, it basically gets out of your system. It's there. Okay. So let's go on to the next slide. Chelsea, tell us about Move.
Move. We have 33 dispensaries. We're opening up our Spring Hill location on Friday. On my coast, we have soon 2 Bradenton locations, location in Sarasota, as well as Northport, Cape Coral, Fort Myers, Bonita Springs. Move, we pride ourselves on educating each and every patient that walks through our door and providing them with the best customer service possible. In addition to those questions that you get answered within the dispensary, we have a customer care center that you can call with additional. So for example, you leave the dispensary with your medications in hand and forget everything that was said, which is very common. There's an 800 number that you can dial and speak to someone over the phone or speak to them virtually to have your questions answered.
I put this in here because here's your patient care team down here. Here's your 833 number.
Yes.
And what I find and it's free. And so if you need consultation on a particular subject, really take advantage of these consulting services by Move. They'll be able to help you quite a bit.
Yes, absolutely. You can do a live chat as well if you want to see someone face to face.
Right. And you also you can not only order online, but you can also get delivery. I got a delivery today.
Yes, and delivery, like it says, 20-mile radius, and that covers many of our locations. As you can see, we have locations sporadically placed throughout the state of Florida. More coming, gosh, it seems every month now.
Yeah, you guys, you're adding, it's hard to keep up with y'all. You guys are moving really, really quick. Now,
yes, it's overwhelming.
Yeah, I do want to, you talked about strain print. Why don't you tell me a little bit about strain print for a second?
Strain print, yes, it is, can't really call it our own little clinical platform, but you really can. What strain print is capturing what's working, what's not working for specific people with specific diagnoses. So for example, someone with PTSD, stress and anxiety, strain print allows you to look and see what is working for other patients and what is not working for other patients. What it also allows you to do is track your medication, your results, and your lifestyle throughout the usage. So once you try, let's say, for example, you get the indica soft chews to help you sleep. You place in strain print what your diagnosis is, what medication you're using, and you begin tracking it. the next morning, Strain Print is going to send you a notification and ask you how you slept, how you feel. And you're going to be able to put that in there and keep track night after night after night what your results are, so that you can begin dosing up, dosing down, whatever you need to do. Should that not be working, look back in the archives and see what's working for someone. Strain Print is a wealth of knowledge, and it's really going to connect you with individuals who are suffering from the same diagnosis, same illness, and it's going to allow you to get the medication, and really eliminate a lot of the guesswork and finding that happy spot.
Yeah, Strain Print is really good. It reminds you when you should take your products, and it's a good, like I say, it's a very good journaling, and it's a very easy to use journaling application that's out there. It's really cool. So Chelsea, we're getting on, like getting out about 7:30. You can order, you can go to your dispensary, but you can also order online. You can get delivery, and then also I really recommend your patient care product. Is that correct?
Yes, absolutely. And then going back to another mention you made, we also have a CBD. So if you go to Move CBD, you can look for CBD products that you can also order, should that be of interest.
And I should mention that our My Botanical Wellness site also sells Move CBD products. We handle that as well. So,
Yep.
again, we did high quality products. Cool. Well, listen, it's been, we think we've got all the questions answered. It's been very informative for a lot of people. I do want to mention as a wrap up, by itself, medical cannabis is not, it's not a magic wand. It's kind of like fairy dust, but that's not a magic wand. If you're using medical cannabis, pay attention to your basic health care. Pay attention to your diet. Pay attention to your mindfulness. Meditation really helps. Talk to people about your particular condition, especially if it's anxiety and stress. You think about the balanced lifestyle that you can have to be able to have you restore the control of your life. Chelsea, you've got some closing comments you want to give us?
I love what you said. You know, it is a lifestyle. And I would challenge anyone that's going to set forth on CBD and THC and look for that perfect ratio for them to add at least one more balanced living, healthy activity to their life, whether it be take a walk, water the flowers, you know, sit and meditate for a minute. Because Marc is exactly right. It is a lifestyle. And the more health and wellness we can incorporate, the better our results are going to be all around.
Sure. I mean, I know, and you know, I know that in my life, I work on a number of websites. I have a number of social media networks, plus a couple of grandkids and a few other things. I've taken up Tai Chi. I practice Tai Chi every day. It helps me quite a bit. It's helped me balance. It helps me reset. Candidly, after this webinar, I'll go do my Tai Chi session just to kind of just relax at the end of the day. And it really helps. I could not live my life without medical cannabis because of the amount of pain that would be related to the herniated discs. But I can tell you, by putting the whole mosaic together, it really helps me lead the life I want to live.
Yeah.
So, Chelsea, thank you very much for tonight. And more importantly, I want to thank each and every one of you for watching. I know it's been a long webinar. It's been about an hour and a half for everybody that's out there. Thank you for joining us. I'm going to throw a shameless plug. And next week we have fibromyalgia. So please join Dr. Michelle Weiner and myself for that particular webinar. But more importantly, Chelsea, thank you very much. And thank you, Move, for sponsoring. You have some closing comments?
No, thank you. I thoroughly enjoyed this. I'm so glad so many people participated. The questions were fantastic, and I love the back and forth. So thank you for having me. I look forward to doing this again soon.
Great. And thank everybody for joining us. I know that it's been a long webinar, but like I said, our goal is if we can just have one person get their life back, then I believe we'll be able to, that this will be successful. And I think we can help more than that. Anyway, you all have a good evening. Thank you very much. And try medical cannabis. It's going to help you with stress and anxiety. Thank you.